Let me tell you about a patient I'll call Robert. Robert was 52 years old. A tough guy, retired military, the kind of man who didn't complain about pain. For 6 months, Robert noticed blood in the toilet bowl. Just a little at first. Then, it became frequent. He did what millions of people do every single day. He went to the drugstore, bought a tube of hemorrhoid cream, and told himself, "It's just piles. It's annoying, but it's nothing." He treated himself for 6 months. He ignored the fatigue. He ignored the fact that his bathroom habits were changing. He assumed, because he was embarrassed, because he was busy, because he was afraid, that he knew the diagnosis. When Robert finally walked into my clinic, it wasn't because he wanted to, it was because he collapsed. We didn't find hemorrhoids. We found a mass in his rectum that had been growing for those exact 6 months he was applying that cream. I am not telling you this to scare you. I am telling you this because Robert's story is the single most common tragedy I see in my line of work. I am a doctor of medical science with over 10 years of experience treating this specific condition. And today, I am going to give you the number one reason, the absolute, non-negotiable reason why you must get a proper medical diagnosis for your symptoms. It is not just about comfort. It is about survival. We often call hemorrhoidal disease the Great Imposter. Why? Because it has a very famous, very dangerous evil twin. You see, the symptoms of hemorrhoids are deceptively simple: rectal bleeding, itching, a lump you can feel, pain while sitting. Here's the problem. These are the exact same symptoms of colorectal cancer, anal cancer, and inflammatory bowel disease. When you see blood in the bowl, your brain wants to protect you. It whispers, "Don't worry, it's just a hemorrhoid. You sat on the toilet too long. You strained too hard." And 90% of the time, your brain is right. It is benign. But medicine isn't about the 90%. Medicine is about catching the 10% that can kill you. The number one reason to get diagnosed properly is exclusion. We need to exclude the possibility that what you are feeling is a tumor masquerading as a swollen vein. Research tells us that rectal bleeding attributed to hemorrhoids is the single most common missed opportunity to diagnose cancer early. I know what you do. We all do it. You type "bleeding when I wipe" into Google. You read a forum. You see someone say, "Oh, eat more fiber. It'll go away." Here is what the internet can't tell you. The color of the blood matters, but it can lie to you. Classically, we say bright red blood is hemorrhoids, and dark tarry blood is something higher up in the colon, possibly cancer. But this is not a golden rule. I have seen low-lying rectal cancers that bleed bright red. I have seen hemorrhoids that bleed so profusely they look like a trauma injury. You cannot diagnose the source of internal bleeding by looking at a piece of toilet paper. You need eyes on the inside. Let's talk about the lump. You feel a bump while showering. You assume it's an external hemorrhoid. But did you know that anal cancer often presents as a hard lump near the anal margin? To an untrained finger, they feel similar. To a specialist's eye, they look very different. Self-diagnosis is a gamble where the stakes are your life, and the odds are not as good as you think. I know why you haven't come in yet. It's embarrassment. You are thinking, "I don't want a stranger looking down there." You are thinking about the exam. You are dreading the finger test. Let me demystify this for you right now. Let me take the fear out of the room. When you come to a specialist like me, we are not judging you. We have seen thousands of bottoms. To us, it is just anatomy. It is just tissue we want to heal. The exam is fast. First, we talk. I listen to your history. Second, the digital rectal exam. It takes less than 10 seconds. It is uncomfortable, yes, but it is rarely painful. Third, we might use a small tool called an anoscope. It's a small tube, no bigger than a finger, with a light on it. It lets me see the tissue clearly. And if, only if, we see something suspicious, or if you are over the age of 45, we schedule a colonoscopy. The colonoscopy is the gold standard. You are asleep. You feel nothing. And here is the magic of it. If we find a polyp, a tiny growth that could turn into cancer in 5 years, we remove it right then and there. We don't just detect cancer, we prevent it. Think about that. By coming in to check your hemorrhoids, you might actually be preventing a cancer that hasn't even started yet. That is the power of proper diagnosis. Now, I don't want you to panic. It's not always a choice between hemorrhoids and cancer. There is a middle ground of conditions that are miserable if treated incorrectly. Take anal fissures. These are tiny tears in the lining of the anus. They burn like fire. If you treat a fissure with hemorrhoid cream, you might actually make it worse because some creams restrict blood flow, and a fissure needs blood flow to heal. Take anal fistulas. These are infected tunnels between the skin and the anus. No amount of cream will fix a fistula. It requires surgery. If you let it sit, it becomes an abscess. By guessing, you are delaying the right treatment. I have patients who suffered for years with what they thought were hemorrhoids, only to find out it was a fissure that I could cure in 2 weeks with a simple compounded ointment. 2 weeks. After years of suffering. Why wait? Let's go back to the number one reason. It's not just medical. It's psychological. There is a weight you carry when you don't know. Every time you go to the bathroom, there is that split second of anxiety. Will there be blood today? Is it getting worse? That anxiety eats at you. It ages you. The moment you get a clean bill of health, the moment I tell a patient, it is just a grade 2 hemorrhoid. Here is how we fix it. You are fine. You can physically see the weight drop off their shoulders. Proper diagnosis gives you your life back. It allows you to stop worrying about dying and start focusing on living. If you are watching this and you have symptoms, bleeding, pain, lumps, itching, I have one request for you. Put down the phone. Turn off the computer. Call a doctor. If you are over 45, get your colonoscopy. If you are younger but have bleeding, see a proctologist or a gastroenterologist. Don't be Robert. Don't let embarrassment or assumption rob you of your future. Your health is worth a 10-minute awkward conversation. I hope this video helps you make the right choice.